No, I fully agree. And, one thing that we often see is siblings having to come to terms with each other. I can give you so many examples where, you have one sibling, we'll use your situation. They lived in Arizona. The one sibling lived locally in Indianapolis with the mom and the dad. And, that sibling seeing the day to day, week to week changes, which is prompting a concern. So they're reaching out to that sibling in Arizona, trying to get them on board, but then they'll call and have a short, superficial conversation with mom and dad, and they think everything's fine because the conversation was great. It's nice here, we're doing good, great to hear from you. What are some of the early signs, though, that should prompt these adult children to start exploring home care?
Yeah, so I think if you notice any obvious physical or health changes, so if your loved one is experiencing frequent falls, that's something that's fairly common, or new bruises when you're visiting mom and dad. If you notice, unintended weight loss, missed or incorrect medications, all of these are signs that maybe things aren't as they've always been, and we need some more attention to mom or dad in their daily living habits. Speaking of daily living habits, I think, difficulty with bathing, dressing, grooming, noticeably declining hygiene in your loved one is an obvious sign. When you're visiting them in their house, in their space, if you're noticing an unusual amount of clutter, or a lack of groceries in the cupboard or the refrigerator, unpaid bills on the kitchen counter, all these things should be warning signs and red flags to families that mom or dad might need a little bit of additional help.